Ozempic, all you need to know about. What is Ozempic? Ozempic, semaglutide, injection half a milligram, 1 milligram, or 2 milligrams is an injectable prescription medicine used along with diet and exercise to improve blood sugar in adults with type 2 diabetes. To reduce the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes with known heart disease. It is not known if Ozempic can be used in people who have had pancreatitis. Ozempic is not for use in people with type 1 diabetes. It is not known if Ozempic is safe and effective for use in children under 18 years of age. What is the most important information I should know about Ozempic? Ozempic may cause serious side effects, including possible thyroid tumors, including cancer. Tell your healthcare provider if you get a lump or swelling in your neck, hoarseness, trouble swallowing, or shortness of breath. These may be symptoms of thyroid cancer. In studies with rodents, Ozempic and medicines that work like Ozempic cause thyroid tumors, including thyroid cancer. It is not known if Ozempic will cause thyroid tumors or a type of thyroid cancer called medullary thyroid carcinoma, MTC, in people. Do not use Ozempic if you or any of your family have ever had MTC, or if you have an endocrine system condition called multiple endocrine neoplasia syndrome type 2, MEN2. Do not use Ozempic if you or any of your family have ever had MTC or if you have MEN2. You are allergic to semaglutide or any of the ingredients in Ozempic. What are the possible side effects of Ozempic? Ozempic may cause serious side effects, including inflammation of your pancreas, pancreatitis. Stop using Ozempic and call your health care provider right away if you have severe pain in your stomach area, abdomen, that will not go away, with or without vomiting. You may feel the pain from your abdomen to your back. Changes in vision. Tell your health care provider if you have changes in vision during treatment with Ozempic. Low blood sugar, hypoglycemia. Your risk for getting low blood sugar may be higher if you use Ozempic with another medicine that can cause low blood sugar, such as a sulfonylurea or insulin. Signs and symptoms of low blood sugar may include dizziness or lightheadedness, blurred vision, anxiety, irritability or mood changes, sweating, slurred speech, hunger, confusion or drowsiness, shakiness, weakness, headache, fast heartbeat, and feeling jittery. Kidney problems, kidney failure. In people who have kidney problems, diarrhea, nausea, and vomiting may cause a loss of fluids, dehydration, which may cause kidney problems to get worse. It is important for you to drink fluids to help reduce your chance of dehydration. Serious allergic reactions. Stop using Ozempic and get medical help right away if you have any symptoms of a serious allergic reaction, including swelling of your face, lips, tongue, or throat, problems breathing or swallowing, severe rash or itching, fainting or feeling dizzy, or very rapid heartbeat. Gallbladder problems. Gallbladder problems have happened in some people who take Ozempic. Tell your healthcare provider right away if you get symptoms which may include pain in your upper stomach, abdomen, fever, yellowing of the skin or eyes, jaundice, or clay-colored stools. The most common side effects of Ozempic may include nausea, vomiting, diarrhea, stomach, abdominal pain, and constipation. How Ozempic works to lower blood sugar and A1C in adults with type 2 diabetes. Non-insulin Ozempic works with your body's own ability to lower blood sugar and A1C. Ozempic is designed to respond when your blood sugar rises, helping your body to release its own insulin. Ozempic works in 3 ways to lower blood sugar. Helps your pancreas produce more insulin when your blood sugar is high. Helps prevent your liver from making and releasing too much sugar. Slows down food leaving your stomach. How to take Ozempic? The beginning dose is 0.25 milligrams once a week for the first 4 weeks. This will help give your body a chance to get used to the medicine. At week 5, your healthcare provider will increase the dose to half a milligram once a week. Your A1C needs may shift as your type 2 diabetes changes. That's why Ozempic offers pens that deliver doses of 1 milligram or doses of 2 milligrams to give you additional A1C control. And while your dose may change, nothing will change about how you take Ozempic. The 1 milligram and 2 milligrams dose pens are similar to the pen you already use. Take Ozempic once a week, on the same day every week, exactly as prescribed by your healthcare provider. You can take Ozempic with or without food. You may change the day of the week you use Ozempic as long as your last dose was taken 2 or more days before. What would happen if I missed a dose? If you miss a dose of Ozempic, take the missed dose as soon as possible within 5 days after the missed dose. If more than 5 days have passed, skip the missed dose, and take your next dose on your regularly scheduled day. Is Ozempic proven to lower A1C? A majority of adults taking Ozempic reached an A1C under 7% and maintained it. B. In 2 different studies, adults lowered A1C, on average, by Ozempic, 1.4%, half a milligram, and 1.6%, 1 milligram, versus placebo, 0.1%. Ozempic, 1.9%, 1 milligram, and 2.1%, 2 milligrams, taking 1 or 2 diabetes pills. From a starting average A1C of 8.0% and 8.9%, respectively. In the same 2 studies, the majority of people reached an A1C under 7%. Ozempic, 73%, half a milligram, and 70%, 1 milligram, versus placebo, 28%. Ozempic, 56%, 1 milligram, and 64%, 2 milligrams. The American Diabetes Association, ADA, recommends that a reasonable goal for most adults with type 2 diabetes is an A1C less than 7%. Your healthcare provider. Has Ozempic been studied for cardiovascular risk? A study showed that in adults with type 2 diabetes and known heart disease, Ozempic lowers the risk of major cardiovascular events such as stroke, heart attack, or death. Will Ozempic affect my weight? Ozempic is not a weight loss drug. In 2 different studies looking at A1C, adults lost on average Ozempic, 8 pounds, half a milligram, and 10 pounds, 1 milligram, versus placebo, 3 pounds. Ozempic, 12 pounds, 1 milligram, and 14 pounds, 2 milligrams. From an average starting weight of 202 pounds and 219 pounds, respectively. While many people in this medical study lost weight, some did gain weight. If you like my video, please share and subscribe.